So obviously we're all going through a really serious and important event at the moment in the impact of COVID-19 on our lives. And what we're doing with children of the 90s is that we're trying to get information from the whole population of Bristol to help us understand that problem. So normally what tends to happen is we get information from those who are unfortunate to be ill, and we understand what's happening to them in hospital and how they're recovering or how they're having worse outcomes. But what we're not really understanding is what else is happening in the population. We don't really know how prevalent the disease is, the infection is at the level of the population in the young, and indeed those who are potentially just having minor symptoms. Now, all of those people might be infectious and could be sources of transmission, but we don't really know how much of a problem that is, and of course it has an effect on how we manage the virus going forward. So we're really trying to understand prevalence, that's one thing, so that's how frequent it is, but there are two other parts of the story that are really important as well. So one of those is to do with why some people do well and some people do badly when they get COVID-19. And one of the great things about Children of the 90s is that we've been working for 30 years now with the population of Bristol, and we have lots of information about lifestyles, about biology, about things that might contribute to outcomes when one has COVID-19. So we want to use those data not just to understand why people are doing well, but of course to understand the counter, which is what might be happening in people who don't do so well. And then the last part of the story is that we want to understand what the effect of mitigation is on our lives. So there are these steps now in place that are changing our behaviour and our work, the way that we interact with our friends and family, and we really need to understand these important changes to our lives and the effect that they have.